go over some of the states in the US that are reopening and see what is happening there and how are they reopening. And I wanted to specifically talk about New York and Georgia. Secondly, I wanted to go over some of the other countries as well, which have done relatively better. I wanted to have a good news. So I wanted to see those countries that have done relatively better and what is the news there. And finally, I wanted to go over some of the hydroxychloroquine studies. So that fight, that war continues. And there are some more studies that are interesting. And I wanted to go over those with you. And you have been, in your comments on YouTube at least, have been talking about zinc and the hydroxychloroquine. So I want to show you a study which proves that that is something that is useful and valuable. And we will go over that. And I have been saying right from the get-go that the hydroxychloroquine plus zinc plus azithromycin, these are the things that need to be given early on when the viral replication is happening at a fast pace, and we need to stall that or slow it down. At later stages, when the patient is in ICU, then we need to take care of the immune system more than just the hydroxychloroquine. So I think I was correct in that. And so there is a study I wanted to show which proves that. So with that study, let's start. So today, hello guys, welcome. And let's start our discussion today. Instead of drawing some medical stuff today, I'm going to be mostly talking about the various countries and various drugs, especially hydroxychloroquine and remdesivir. One news over there, one with hydroxychloroquine and one with zinc. So let's start. I'm going to share my screen. Good evening. We used to have Greg from Australia. I haven't seen Greg for some time now. So welcome, guys. Good morning, Aksa. Perfect. So let's look at it. So unfortunately, we are at 4.5 million confirmed cases and 307,000 deaths. So that continues. What I thought was very interesting is Georgia. So Georgia, I believe on 27th of the last month is when they had opened up. 24th of last month is when they decided that they would open up. Good morning, everyone. So they had decided to open up at that time, and there were lots of concerns that as they prematurely, I'm making air quotes here, as they prematurely open up, what will happen, and we'll have another wave there. And they have been wise about reopening. So look at it. This is after the reopening. So I think they reopened on 24th of April. That was a Friday. And after that, there have been 2 days when they had very high number of new cases. So 932 and 930. But after that, their new cases have dropped. And if you see here, this is still 7 days where data may not be accurate because people may not have reported it yet, or they are waiting on their tests. So they cannot tell the exact numbers. But whatever numbers are there, they do not look bad. And even if we look at this number here, the 7-day moving average is downwards. So Georgia has partially reopened. I think people have been wise about it, and there is not a big surge there as was expected. And I read some articles where businessmen have been saying, or businesses have been saying that, hey, we've been very careful. Restaurants are saying that they are slowly filling now, but most of them are working from curbside and offering takeaway and so on. So good job on Georgia's part that they went with not a lot of issues so far. And I wish and pray that that stays that way. Then is New York. So of course, New York has been an epicenter here in the US, and quite an unfortunate situation there, but they have been doing really well nowadays. So I wanted to show you some of the data that New York has. So 1.3 million tests done. and 345,000 positive cases. And look at this distribution between male and females, 48% males and 51% females. And look at this. If you see here, in terms of fatalities, males have 51% cases, but they are making up 58% people who are dying. Females are 48% cases, but they make up 41% of the people who are dying. So females are lesser in getting the severe case of the coronavirus compared to men. In New York, 109 children have been reported, and their definition of children is people below the age of 20, including 20. So I should have said equal or lesser than 20. And there have been 3 deaths reported so far. Now, here is an important thing, and I wanted to show you this live cam as well from New York. Here. So this is Times Square. In the New York, wearing face mask has now become a requirement. So if you see here, this is Times Square live cam, and everybody has a mask on. Unfortunately, they are having their pictures taken and they have the masks on as well. So that's going to be an interesting time. This person doesn't have a mask on, but majority I saw today were wearing their masks. So New York has made the masks a mandatory, a required thing if you are in public. So Brandy says Arkansas has done well, but last few days our cases have gone up a bit. Interesting. I'm going to look at Arkansas as well to see what is going on there. So thank you, Brandy. So New Yorkers are now required to wear a mask. Look at this. Their total population of the New York State, 19 million. New York City, 8.39 million. 1.3 million tests done, 345,000 positive out of those who are tested. That is 26% almost. So if we are testing 1.3 million people and 26% are positive, I think that tells us something about the herd immunity developing as well. And then 22,304 fatalities, which is 6.46% of the positives, these guys. And we talked about the patients and fatalities and the children. Now, New York is the first state now in this country, in the US, which has actually taken on the child inflammatory disease, the one that is triggering Kawasaki. So the child inflammatory disease, and made that as a situation, as a disease for which healthcare workers have to report. So I was impressed by that. So if you look here, they're saying, so this is the latest, it is May 15, that is today. And over here, you would see that New York has issued first in the nation, I'm reading here, first in the nation criteria to healthcare professionals establishing an interim definition of COVID-19 related inflammatory illness in children. And I believe I have it open here. So I really was impressed with this one because this is important. Although there are just 110 cases, I should say just the kids are really a sensitive matter for all of us. And so even one child sick is too much. So number one, 1% of the cases out of all are children. And again, the definition lesser than 20. Secondly, out of 119 reported confirmed cases, 3 deaths in New York. And this is the breakdown. So if you see here, the cases that have been reported have been mostly from 1 year of age till 19 years of age. Lesser than 1 year of age, 5%, 20 to 21. Then this is the race breakdown I said in description, so you can look at them. But what I wanted to show was this. This is very interesting. So this is what New York is now asking the healthcare professionals to say, that if you see a child that has prolonged fever more than 5 days, difficulty breathing, feeding infants, severe abdominal pain, change in skin color, trouble breathing or breathing very quickly, that is tachypnea, racing heart or chest pain, decreased amount of frequency in urine, lethargy, irritability, confusion. If you see them, then they have to report them. So I am impressed with this because this would help us figure out the hypercoagulability or cytokine storm-like situation in children. So that was good. The other thing that they've done is all nursing home staff. This is really interesting, that all people who are working in nursing homes and taking care of the vulnerable, they are going to be tested twice per week. Yes, Kelly, they do not have anything about the COVID toes, but I think even this set of symptoms can be interesting. And Jim says vitamin D3 prevents Kawasaki disease in children. Vitamin D3 is important for all of us, especially with COVID-19. So all nursing home staff be tested for COVID-19 twice per week. I really like that. Now, the New York City is also providing a guide opening of the counties or the smaller zones. So I liked what they had done. So they have a 7-step reopening guide, which I think is interesting to look at. We had been hearing this guide for some time, this one, and that is that declining total hospitalizations, declining number of deaths, declining new hospitalizations over a 14 days period. If that happens, the state or the area, the community can open. New York has actually extended that. First, they're saying monitoring the new infections by looking at if you are a county that has all the new hospitalizations, total hospitalizations and deaths declining for last 14 days. That is one criteria for reopening. The one or three criteria. Then the healthcare capacity. Hospital bed should at least be 30% of the bed be available. 30% of the ICU beds also be available. That is the ICU and hospital capacity should be available before a community decides to reopen. Then the diagnostic testing and contact tracing capability. So they must have diagnostic testing, and what is their criteria? 30 tests per 1,000 people per month. They should be able to do that. If they can, then they can open. And then contact tracing capability, and they have a very decent set of, so here is a write-up for how the contact tracing will work, how the contact tracers will find the people and then go and interview them and find more people and so on. So that is also interesting. So Kelly says 30% of what? Do we even hit that during normal times? I mean, a hospital stays open by having beds filled. You are correct, Kelly, and this is the criteria. So maybe hospitals would declare that we are on average 30% empty, or our beds on average are 30% available, or maybe they create new accommodation, or maybe they reserve a wing. So that's a very good question. I'm going to ask some of my friends who are working in New York to see what they're doing. So this is in New York. Very interesting case. I'm impressed by two things here: nursing home staff being tested twice a week, and secondly, children's inflammatory situation declared. Then I want to look at Taiwan. So many of you have been sending me comments and emails and notes to say, why are you not talking about Taiwan? They actually thought that for some reason, if Taiwan and China has a dispute going on, or China says Taiwan is part of them, and so somehow I decided to not talk about Taiwan. So that's not the situation. So let's talk about Taiwan. I am apolitical. When I'm talking medicine or when I'm talking about the situation here, COVID-19, I'm not looking at my own politics or people's politics. I'm just looking at some of the data. So here, Taiwan, population 23.78 million. So almost a little more than New York state. Cases 440, deaths 7. So how are they doing this? As soon as they knew that there is an outbreak going on in China, they had closed their border and started a very, what they called, wise but strict lockdown, or sensible but strict. What are they doing nowadays? So temperature checks for all the visitors. So if you're an international visitor and you end up in Taiwan, they are going to take your temperature. That is one. This is the same thing that happens in South Korea as well. Then you're not allowed to use public transport or cabs. They will have specialized cabbies and taxis that would bring you to your place for 14 days of quarantine. Kelly, I'm okay. I understand what you're saying. And we'll talk about Florida and California as well. But look at least the methods that they are doing. So there is special transport, and that is the same case in South Korea as well, that they would bring you from the airport to your home, where they would ask you to quarantine or isolate yourself for 14 days. In that process, they would also install an app on your phone through which they can track you. And of course, that's not going to happen here in the US, but this is what I'm talking about, what they are doing. So they'll install that app. Then they would ask you to stay in. And if you break or if you violate the quarantine or isolation, that fine is anywhere from $3,333 to $333,000. So that's like back-breaking fine. In South Korea, the fine for breaking the isolation or quarantine is $8,000 or 1 year jail. So here the fine is there. And if your phone's batteries are dead, or you have entered a low reception area, police will come over and they'll ask that where is that person. So that is quite strict. And they do that for 14 days. You can't use public transport. There are special taxis offered. Of course, the taxi drivers who are volunteering or are agreeing to do this, they are at risk as well. So number one, they're paid $116 per day with or without any service they provide. So if they are not called for any visitors to be brought to their home, even then they get $116 per day. And after 30 days, the taxi and the driver have to go in quarantine. Kelly, I totally agree with you that if somebody says that, hey, you need to install this app, and then we're going to monitor you for next 14 days. And as soon as you move out of your isolated place, we're going to come over. The cops are going to show up. I think that's going to become an issue. But Kevin says I'll be in jail. I think I'll be in jail as well. So I believe the current R naught is 2.5 to 3. So their R naught is low, but that is our R naught here in the US. Anyways, so back here, there are some things that we can do. For example, wearing masks is nothing bad. It is actually good. Those who can wear masks should. Social distancing should be good. Sanitizing the hands and putting sanitizers everywhere, which I see nowadays everywhere sanitizers are popping up. So there are some good practices as well that communities can share. So a month later, the taxi driver and the taxi goes in quarantine. They have to put a GPS on the taxi, so the taxi can be seen to be parked where it should be, and the person has to be in quarantine for 14 days. So with this, business and facilities are checking temperature. So when you enter a business, a bank, or a place, let's say restaurant, they would check your temperature, number one. Number two, they would take down your name and phone number. Then parents are asked to check children's temperature every day. And if a child has fever, don't send them. And then schools are checking the temperature in the school every day as well. So social distancing continues, but hear this out. Doug, thank you very much. Appreciate that you're here and we are discussing these things together. And there's a question here from Riyadh. About New York, what do they mean by death declining? Are talking about purchasing percentage or number due to total cases declining? I did not say that about the New York. I talked about Georgia. I haven't looked at New York's trends. Okay, so back here. Social distancing in Taiwan. 100 people's indoor gathering allowed with, I believe, masks and then social distancing, voluntarily, and 150 people outdoors. So with this is Taiwan, 440 cases, 7 deaths. Take it with a grain of salt, or you make your own opinion. I'm not sitting here saying these are good numbers or bad numbers. There was an interview from one of their doctors, and they asked him that, do you think that the numbers are correct? And he said that what we are seeing in our hospital is similar to what they are saying from the government. But again, I'm not there, so I do not know what is the right answer there. So Taiwan, good job. Then is Mauritius. I also wanted to talk about Mauritius because Mauritius is the first African. I know that everybody wants to talk about Italy and Spain and UK and US. I wanted to see some other countries as well and see what good news is there. So Mauritius, first African country with no cases, 0 cases since 427. Population 1.26 million. So a small, tiny population. It's an island. It's a tiny island in Indian Ocean, I believe. 332 cases, 10 deaths so far. First case was announced. First 3 cases were announced on 18th of March. Since then, they went into a lockdown. They did contact tracing. They have a phone app which updates you that if you were ever within 100 meters of someone who is a confirmed case. Yes, I'll talk about the new studies today as well. Then is Madagascar. Very interesting again. So Madagascar is a larger island next to Mauritius as well, same nearby place. Population 26.26 million. Cases 238, 0 deaths. 0 deaths. Yes, Kelly, that is very correct. They went right into the lockdown and they didn't mess around. And now when they are opening up again, they are very, very careful in how they are opening. Madagascar, 26 million. So again, more than New York. 238 cases, 0 deaths. First 3 cases on 320. International flights were suspended on 320. Lockdown in 2 cities. I think they may have been their larger cities. Tourism is their main way of earning, so tourism is affected. And here is the funny thing, which is interesting, and that is that Madagascar has a herbal concoction or a tea that they call it COVID Organics. And they claim that that tea can cure coronavirus. And their president of Madagascar has been slamming WHO for not accepting and adopting that herbal medicine. So WHO has said recently, I was looking at it, it's somewhere over here. I believe it is here. WHO to study Madagascar's drug to treat COVID-19. So WHO has finally said that, okay, we are working with them. So WHO has been working in the traditional medicine sector. We work very hard to facilitate collaborations to incorporate traditional medicine in the national health system. So this is by director of WHO in Madagascar. So they have been working on it, or at least they have engaged. So Atush, I would talk about, so there is a question that why are India's numbers rising? So of course, India is a big country and spread becomes double every 10 days. So the numbers are going to rise. So we will talk about India as well. Bhargav Patel says, why my comments are not read? Well, I put your comment on screen. How about that? Happy now? Kelly says there are several good Chinese traditional medicine tests that seem to have good results. Correct. The basic thing is that can we prove it? Are there any? Yes, Bethel, that is COVID Organics. And their president is very much for it. And they're saying that, hey, why are you not accepting it? Can anyone share sir's deleted videos? So one good news there, I believe, I haven't yet confirmed it, that is it available for everyone? I believe hydroxychloroquine video is back. So I had done the appeal, that is back. Remdesivir and ivermectin are still not back. So fingers crossed. So that is Madagascar. They have a COVID Organics, and that is being manufactured there. And they want to offer it to the remaining Africa and hopefully to the rest of the world as well. WHO would have to figure this out. Then another country, Senegal. Population 15 million, cases 2,300, deaths 25. They have a test. So again, take it with a grain of salt, because in the article when I was reading it, they are saying that if it works. So trials to develop $1 COVID-19 testing kit that produces results in less than 10 minutes are underway in Senegal. And they are doing this. So there is Diatropics research with a company based in UK called Mologic. So these two companies are making a $1 test, which can then also do the test within 10 minutes. So if that is the case, we should make billions of those tests and give them out everywhere. But important thing is they continue to say in this, um, if it properly validated and found to be reliable, then it have been a major positive. So they're still working on it. So I thought that was interesting that we have I had heard that there is a similar test kit available somewhere in I think Taiwan or some other place, which is also under $1. So Siddhartha, your question about the test kit, this is an RNA test kit. So there is a question, how much placebo, I believe you mean, drug will affect on people like Madagascar, I think. I don't know. Hey, Jennifer, how are you? Khalid says, sir, my country, Somalia, the number is 1100 and we are totally not in lockdown. What advice you can give us? So Khalid, I'll have to look at the country's data and some articles and studies before I can just speak. I spend my day kind of looking into these articles and studies and take some notes, and then I talk about it. So give me a day or two and I'll talk about India and Somalia as well. So then my country of origin, Pakistan, population 220 million, confirmed cases 37,000, deaths 803. I think that there is a mixture of good reporting versus bad reporting there. So there may not be the accurate reporting, but that is the reporting they have. What is interesting there? Couple of things. One, Pakistan has lifted the lockdown partially, where they have asked the schools to stay closed. So I am very, very happy about that, because I am afraid of schools opening up and children going out, because one, they are at risk, and secondly, they can become asymptomatic transmitters or spreaders, and they will make others sick. So children, and because they can handle COVID-19 much better than others, we should keep them not in the schools, not in the crowds, so that they will be okay, but they would make others sick, and we don't want that. So Pakistan has not opened up the schools and colleges, and I kind of am happy about it. I had sent some notes as well to the Prime Minister of Pakistan that we should not open school and colleges, even if the remaining businesses are opening. So schools, colleges not opened, businesses opened, factories opened. So if you see here, they are the people shopping, because this is Ramadan and then Eid is coming in 10 days. So people are shopping. Look at this crowd of cars after the lockdown was eased. Man, I can only imagine what would happen with the cases now. So that is concerning to me. And in another couple of days, I think they're going to open up the transport, public transport as well, which can cause more issues. But at the same time, Pakistan's Prime Minister's point of view is that we do not have a very rapidly spreading virus. And that is interesting. Someone, maybe us, we should do a study that why in some countries, African countries, Asian countries, spread is not that fast. And how did Europe and US get more impacted? So the other thing which is interesting is, this is another news from Pakistan, that Pakistan said to make and export anti-COVID-19 drug remdesivir. So Gilead is going to work with Pakistan. So there is a company there, Frozen's Labs. They are going to work with Gilead to, number one, get the technology transfer, and number two, start making remdesivir. Gilead has also contracted with 4 Indian firms as well to start producing remdesivir in mass quantities. So that's an interesting. So somebody, Ahmed says, Somalia already has herd immunity. So somebody has said that, do you think that temperature would be the cause of the slow transmission? It is possible. So my opinion, temperature is the most. Second, I also have a theory. Remember that clean hygiene or hygiene theory, where those areas that or people who live in more sanitized and clean area, I'm trying to say it very delicately so nobody's offended, their immune system is kind of sitting idly and twiddling their thumb and saying, okay, give me something to do. And that is why autoimmune diseases in clean societies are more, and immune reactions are more. And those societies where there is a little more pollution, more dust, and more infective diseases, their immune system is kind of overwhelmed as well by those. And so its response is lesser. And that may be one of the reasons. Temperature may be another reason. We'll see now that the crowds are going to start gathering, as you're seeing. We'll see what happens. The BCG theory that everybody is BCG vaccinated, as many are in India, Pakistan, Middle East, many parts of those areas of the world. That theory, I'll show you a study today that theory seems to be thrown out of the window, but it is only one study yet. There are a couple of more studies going on in Australia and Netherlands. We'll have to see what comes back from there. I have that study up today. I'm going to show it to you. So with this, Pakistan is lifted lockdown now. Schools are still closed. Factories and offices are opened, and now the public transport is going to open as well. So this is about the countries. Now I wanted to show you a couple of studies that are interesting. Two studies about hydroxychloroquine or queens, and one study about the BCG. So let's look at them. So here is a study about BCG vaccination. This study, look at the date here, May 13. This study is done in Israel. What they have done is, look, it looks an interesting study. 72,060 test results reviewed. That's a large number. 3,064 patients born between 1979 and 1981. Again, that is a age range they're saying 40 to 50 years. And then out of them, 2,869 were among likely vaccinated people born between 1983 and 1985 and vaccinated with BCG. And they found out there was no statistically significant difference in the proportion of positive test results in the BCG vaccinated group versus the unvaccinated group. So we have done a discussion as well that BCG seems to be promising, and I had done that discussion that BCG seems to incur or offer two kinds of protections. One is a cross protection to other respiratory illnesses, and secondly, making trained immune cells, innate immune cells, and thirdly, improving T cells and B cells. So from that, it does seem like BCG can help offer help, but here this is one study that came out and it says, no, that's not entirely possible. So the conclusion is this study does not support the idea that BCG vaccination in childhood has a protective effect against COVID-19 in adulthood. Now, having said that, remember there is a study going on in Australia, I believe, with 4,000 healthcare workers who would receive BCG vaccination, and then they would see the incidence and prevalence of the COVID-19 amongst them. And there is another study going on in Netherlands where they are going to see new vaccination and the result of that. So we'll see what are the results of those. So that is the BCG vaccine, slightly not good news there. Then here is another study which actually made me a little mad as well. And somebody sent it to me and said that, hey, this proves that this hydroxychloroquine fever that you all, so somehow it is funny that people who watch my video and I have the disclaimer in the beginning that, hey, these things can kill as well. So don't auto-medicate yourself, self-medicate yourself. There are people who think that I'm against hydroxychloroquine. So they yell at me and send me curses and every kind of a thing because they think I'm somehow against the administration. And then there are people who do not believe in hydroxychloroquine. And they also send me curses that, hey, why are you talking about hydroxychloroquine? It is useless. So somebody sent me this study. And I wanted to share it with you specifically because this is a chloroquine study. It's not a hydroxychloroquine and chloroquine are actually cousins. But there is a difference. Hydroxychloroquine is much more safer. In one of the studies I had showed you in the past when I was talking about hydroxychloroquine, That study said that in vitro, hydroxychloroquine phosphate is 5 times more potent compared to the same doses of hydroxychloroquine. And we know that chloroquine can cause cardiac arrhythmias, and it is more toxic. So when somebody picks up chloroquine phosphate and says, I'm going to do a study, I feel that they either do not know exactly what they're talking about or what they're doing. I'm sorry, maybe now I'll get yelled at for saying that the researchers do not know what they're doing, but it seems incorrect to me that when the world is talking about hydroxychloroquine, somebody goes and does a study on chloroquine and then comes back and says it doesn't work, or we had to stop the study because it has toxicity. So yeah, it has toxicity. Don't use chloroquine. So this is a study which some people are using to say hydroxychloroquine doesn't work, and that is wrong. This is a chloroquine diphosphate study. So yes, they had to stop the study, or they felt that there was more toxic effect, so they didn't continue. That's fine. There was another study in Brazil, I believe, also that stopped. So that's fine. Chloroquine is toxic. Then I wanted to show you this study as well. So this is a study that is going on here, Military Hospital of Tunis, and the study is, look at this, a study of hydroxychloroquine and zinc. So the first important thing here, hydroxychloroquine and zinc. And that is an important thing to note because, and I wanted to show you something. I want to show you one of my video. This is my video on hydroxychloroquine, which got taken down, and now it is, I believe, back. Because if it is not back, then I cannot even look at the video anymore. They just confiscate it. So here, if you see, if I search for the word zinc, see here, there are so many, there are 19 mentions of zinc by the people who have been commenting. And so some folks have been saying that, hey, it only works, hydroxychloroquine only works with zinc. That is not the case, but zinc is an important thing. So see here, ZDOG 8, zinc withheld, that nullifies the study. Zinc is not included in this study. Only a moron would not include zinc. So I'm sorry, that's a comment here. Since hydroxychloroquine activates zinc to kill the virus. So that's not exactly the only mechanism, but that is an important mechanism. So we had discussed this in the past, that zinc has to be added, number one. And number two, we had discussed this many times, that hydroxychloroquine with zinc and azithromycin and these vitamin C, D, at least hydroxychloroquine and zinc should be given early on. Prophylaxis is great. Then in the early stages of when the symptoms are mild, that is great. So because these guys they reduce the viral load. Once the situation has reached a point where the patient is in a severe or serious critical situation, then the immune system is kind of done. The virus has taken over a lot. So now we have to provide medicines that help, number one, modulate the immune system, and number two, take care of the virus with a bigger hammer. So remdesivir, IL-6 blockers, and other immune system modulators are needed. Hydroxychloroquine at that time is not the right choice. And I have done that in the other discussion where I talked about it, that a subpar study has proven hydroxychloroquine doesn't work. And I had made this comment that the patients on which hydroxychloroquine was used were already in ICUs or were almost there to become eligible for ICUs. And you try hydroxychloroquine on them, and that may not work. So here there is a study that would start. And this study is going to finish July 31. It started on May 4. July 31, and so we'll know more over at that time. So I wanted to just quickly, once again, iterate here. The functions of hydroxychloroquine. So see, this is a cell. In this cell, when hydroxychloroquine comes in, number one, what does it do? It increases the pH, correct? Which makes the cell basic, intracellular environment basic, which causes the cellular enzyme to function less, plus those enzymes that are being used by the virus to function less. So that reduces the viral replication. That was one. And I have mentioned it many times. It's funny that even after mentioning it many times, I'm still yelled at by both camps. Those that think that hydroxychloroquine is useful yell at me to say, why do you talk about death can happen with this? And those that feel that hydroxychloroquine is not useful, they say, why are you talking about hydroxychloroquine at all? So it's funny. Anyway, so this is one. Second is, remember we talked about it, that when we have coronavirus, the fusion of the coronavirus with the membrane to allow the RNA from the virus to go in, this fusion with the membrane is reduced or stalled by hydroxychloroquine. Hydroxychloroquine stabilizes the cell membrane, so fusion with the coronavirus becomes difficult. So that is another mechanism. Third mechanism that we had done was, and that was that hydroxychloroquine is a zinc ionophore. So that is, it is a channel to allow zinc to go into the cell, because zinc is charged and normally it cannot go into the cell. So that is one mechanism, important mechanism, because once the zinc comes in as well, zinc is also going to stop or reduce the replication of the virus. So now there are two things that are reducing the viral replication. It's a good thing. But zinc alone is not useful, and hydroxychloroquine alone is not just for the zinc. It does more. So this is the third mechanism. And remember the fourth mechanism? Who remembers the fourth mechanism? Who remembers the fourth mechanism? Which cool bean knows that? That was that, remember the ACE2 receptor? Hydroxychloroquine, and I have mentioned it in many of my videos. Hydroxychloroquine, the last amino acid glycation, when this receptor is being formed in a cell, then at the time of manufacturing this receptor, the last amino acid that needs glycation, meaning a glucose is attached to it. That's like you make a baby and then say, okay, baby, here is a candy for you. So that candy, the glucose, when it is attached, that becomes a complete receptor. Hydroxychloroquine blocks the glycation of this last amino acid. The result is it is a functional receptor, but it has low affinity to bind with coronavirus. So it does not bind with it with that much love and care. And so the result is less binding of virus means less virus entering the cell. So this is the fourth mechanism. There are four ways that this drug helps. So back here. Then I wanted to show you this study. This is another study, hydroxychloroquine. I love this one because they did hydroxychloroquine and azithromycin plus zinc versus hydroxychloroquine and azithromycin alone. So what is the difference here? Zinc. And I love their outcome. It actually proves the thing that I had been saying from the beginning. And what I had been saying was that chloroquine in the early stages with zinc, with azithromycin has a use. And look at this. The addition of zinc sulfate did not impact the length of hospitalization, duration of ventilation, or ICU duration. So people who were already in ICUs or ventilators, nothing happened to them. But zinc sulfate increased the frequency of patients being discharged home and decreased the number of need for ventilation. So this is the people who are not on ventilation, who are not in ICUs. They are still in a moderate state and they can be protected. Admissions to the ICU were low. Mortality or transfer to hospice for patients who were never admitted to the ICU. So people who were never admitted to ICU, when hydroxychloroquine with zinc and azithromycin was used, their chances to go to ventilators were less. Their chances to become discharged and go home were more. Their chances to die were less. Their chances to become transferred to hospice care where they would die a little later became less. What else do we want? And this, we are doing this before the patient is in ICU. So we are not spending a lot of money on them anyways. So give hydroxychloroquine with zinc as well. So what is so bad about that? And then conclusion, this study provides a first in vivo, that means inside the body, evidence that zinc sulfate in combination with hydroxychloroquine may play a role in therapeutic management of COVID-19 patients. I would have added in the early stages of the disease. right? So this is where we are at. I like the study, and I believe, so I had not taken this note down, I'm sorry. I believe this is what we have for today. Um, and to take a break from medical mechanics every day, I wanted to kind of lift our head up and look around and see what's going on in the world. Tell me, so Australia is a South Korea, India. Somebody had mentioned Somalia, so I would look at Somalia as well. So anything else you would like? Jim says I won't be able to get HCQ. Yeah, so hello, Shelly. You're most welcome. So guys, please do me a favor. One, share this, like this, subscribe to it. I do not have a very large voice. I have a small number of people who follow me, and I have less number of shares as well. But I feel that what we are doing here together is useful. So please, if you like it, please share it uh, um, and so. Okay, so this is what we have. Kelly says the vaccination won't be ready for about a year. The trials are 14 months. So Kelly, on that point, the Moderna has said that they would want to start the phase 3 trials in summer, early summer. So that is very useful because we can then move to production very quickly. Similarly, Sinovac from China says that they already have the vaccine and they're ready for phase 3 and beyond. Oxford says that their phase 3 could be started as soon as October, and we have drug available by that time. So I feel that there would be something from end of June to October, November timeframe. Thank you, Chantal, for liking this. I wanted to give us our discussion. So we have the two studies here in Seattle. They begin in March. So Kelly, can you send me the links to those studies? Soha says, nice, great lecture. Thank you very much. A vaccine by October would be great. Yeah, of course, a vaccine now would be great. All right, guys, thank you very much. Enjoy online tomorrow as well, and then a day after. Please tell me what we like to discuss tomorrow. Bye-bye.